This is Dr. Cal Shipley with a review of endocarditis, cardiac valve vegetations, and stroke. Endocarditis can occur when there is fungal or, more commonly, bacterial infection in the bloodstream, a condition known as septicemia.
Multiple sclerosis, MS, is a disease
The organisms travel through the heart. They attach themselves to the valves
which consists
between
of
the
brain,
chambers.
spinal cord, and optic nerve.
The oxygen and nutrient
Everything we do,
environment found
whether
in
it's
both
taking
sides of the
steps
heart,
to solve a
results in
problem
rapid
or
growth
simply
of organisms,
breathing,
which
relies on
form
the
clumps
functions
known
of
as
the CNS.
vegetations.
To understand how MS may impact the CNS, we must explore the disease at the cellular level. In the brain, millions of nerves
vegetations
and
may
neurons
detach from the
continually
valve.
send and receive signals. Each signal is a minute but necessary part of intricate
Vegetations
CNS
are then
orchestration.
ejected into the
It culminates
where
in
they
the
may
actions,
travel up the
sensations,
arteries of the
thoughts,
brain,
and
causing
emotions
obstruction to
that
blood flow
comprise
and
the human
subsequent stroke.
experience. Normally, the path over which a nerve signal travels is protected by a type of insulation called the myelin sheath. This insulation is essential for nerve signals to reach their target. In MS, the myelin sheath is eroded, and the underlying wire-like nerve fiber is also damaged. This leads to a breakdown in the ability of the nerve cells to transmit signals. It is believed that the loss of myelin is the result of mistaken attacks by immune cells. Immune cells protect the body against foreign substances, such as bacteria and
Zenger's
viruses.
diverticulum
But
surgery
in MS, something goes awry.
by Dr. Christopher
Immune
Chang
cells
of Fokker
infiltrate
ENT
the brain and
Consultants.
spinal cord.
In patients suffering from Zenger's diverticulum, there is the abnormal presence of a pouch in the throat which causes food and liquids to get caught during swallow. In a normal swallow study, everything clears easily down the throat, but in a patient with a Zenger's pouch, things get caught causing symptoms of phlegmy throat, food regurgitation, aspiration, and trouble swallowing. Additionally, surgical correction required an incision on the neck and pouch excised, which resulted in a long recovery.
Infective endocarditis is an
However,
inflammation of the heart.
surgical advances
It can damage
in
the
late
valves of the heart,
1990s
the heart
resulted in
muscle,
new
or the
endoscopic
lining of the
techniques
heart.
to correct this problem
It's
without
caused by
any
bacteria
infusion
that
of the
enter the
neck.
bloodstream.
Rather, the entire surgery
Many
is
common dental
performed
procedures, such as routine teeth
After
cleaning, can
intubation,
cause minor
the
bleeding that might
device
allow
is
these
placed
bacteria
in
to
the
enter your
mouth
bloodstream.
and pushed down into
For
the
most
throat where the
patients,
pouch
these
is located.
bacteria are harmless. But if you have a medical
Once the
history
pouch
that
is
includes a heart
visualized
birth
along with
defect,
a common wall dividing
prolapsed
it from the
valve,
normal swallow
rheumatic
tube,
fever,
a laryngoscope is
endocarditis,
placed in rigid
heart
suspension.
surgery, or other problems,
Here you can
we
see
need to
how
take
the
special
laryngoscope
precautions
is
to
placed
protect you.
relative to the pouch.
By prescribing an appropriate antibiotic that you take before your dental appointment, we can avoid the risks of endocarditis. If you have any drug allergies, or if you have questions or concerns about our procedures, please let us know. We want to protect you and keep your teeth
contains
healthy.
organs such as bones,
Here, a metal rod
brain,
is in the normal swallowing
heart,
tube, clearly illustrating the
and
common
reproductive
walls
organs.
separating it from the pouch.
the basic cells that
Sutures
give
are
rise
placed to
to
help
all of the
stabilize the
different
common wall
cells in
in
these organs
preparation for the
are
stapling
called stem
procedure.
cells. One type of stem cell is an egg cell from a woman that has been fertilized by a sperm from a man.
A total of 2 sutures are placed.
This single cell, called a zygote, is the first cell in a developing human being. It's also called a totipotent stem cell because it can form any type of cell in the body, as well as the umbilical cord and placenta. After the zygote has divided a few times, it becomes an early stage embryo called a blastocyst. Embryonic stem cells come from the cells inside the blastocyst. Embryonic stem cells are pluripotent. This means they can form any cell in the body, but not the cells in the umbilical cord or placenta. In the lab, embryonic stem cells are donated from leftover embryos created during in vitro fertilization. In vitro fertilization is a procedure to help a woman become pregnant.
Nothing will get trapped in essence, the pouch has become the new back wall of the esophagus.
of this recommendation is
discharged hours
surgery,
allowed to
but
start
sometimes
training
urgent surgery, that
next
is
day.
during the first week after initiation of antibiotic therapy in the majority of the patients who have an indication for surgery.
It is an instance where eventually the surgery goes parallel therapy and surgery are detected with relevant therapy with the yaw against and system to complete therapy and diagnostic and physical ability. This job and the OS of life in people with relating multiple sclerosis. Although not cure the disease, stem cell therapy seems to be becoming effective for multiple sclerosis to improve disability treatment of those effects and therefore the quality of life. Ay, peluchita, me dañaste el video. Acute osteomyelitis in children. Staphylococcus aureus is responsible for 17 to 19 of acute osteomyelitis in children. Usually, the site of the infection is localized and tubular bone and blood vessels are metastatical, which commonly suffer the initial impact. Clinical manifestation. Most patients develop bone pain for 1 or more days, steady and gradual onset. The pain is usually fluctuating depending on the posture and movement. If all children is localized, which is not often seen in infants or well present with pelvic osteomyelitis are localized in blood bone and only in 25% of cases affect tubular bones or not.
It's a condition that can strike an otherwise healthy child, but knowing the symptoms of osteomyelitis can make the treatment much more manageable. We find out more in today's Health Matters. Bacteria, it not only lurks on doorknobs, keyboards, and playgrounds, it lurks in our bodies, whether we like it or not.
Everyone has a little bit of bacteria traveling around their system, and that can be caused by something as benign as brushing your teeth.
Sometimes the bacteria can travel into the bloodstream and affect the bones, a condition called osteomyelitis. Children are the most vulnerable. Pediatric orthopedic surgeon Dr. Matthew Wagner demonstrates how a child's knee can be affected.
They have leaky blood vessels. The endothelium are the cells that cover blood vessels, and they're not as tight, making this transient bacteria that's in all of our systems a little bit more likely to exit in these areas. The knee, in a skeletally immature patient, is affected in over 50% of spontaneous acute hematogenously spread osteomyelitis.
As Dr. Wagner explains, the bacteria can spread dramatically.
Once it has established itself within the bone itself actually has a network of what's called perversion canals that allows cells within the bone to communicate with each other. The bacteria can then use that to communicate.
That's when children start to show symptoms.
Which is probably one of the most common is pain in an extremity, limp, especially in young children where they can't tell you, Mommy, it hurts here. You will see them favoring one leg. Certainly there can be swelling, there can be redness over the area, and fever. These are some of the more common.
Symptoms should not be ignored. Osteomyelitis can be treated with antibiotics. For those with more severe cases, surgery may be in order. I'm John Bafar. Infants can also be affected. The infection can spread to the joint and cause arthritis.
Diagnosis. The initial diagnostic is based on clinical suspicion. Erythrocytes and infection grade. Cultures of bone. Point fluid and blood cells are helpful. The imaging study included radiography, scintigraphy, and in some cases, ultrasound, CT, and MRI.
In this video, you're going to learn about osteomyelitis, how it's treated. Osteomyelitis is a type of bone infection caused by bacteria that can affect almost anyone. Children who become infected usually have their long bones affected, particularly the bones in their legs. Adults typically see infection in their vertebrae and hips. Since almost anyone can become infected, it is important to understand what some of the risk factors are. Contributing risk factors for osteomyelitis include circulatory problems, including diabetes, artery disease, and sickle cell disease. Recent injury, like bone fractures and punctured wounds. Use of street drugs, non-sterile needles creating puncture wounds near the bone. Osteomyelitis can cause quite a few secondary complications. In children, osteomyelitis can damage the growth plates, which can lead to impairment in growth. Occasionally, the affection can move to the other joints, causing septic arthritis. In the worst cases, the infection can cause the bone to die due to a decrease in blood supply to the bone. Treating osteomyelitis can be a long process. Orthopedic physicians may suggest starting with a bone biopsy to help choose the best antibiotic to treat the particular infection. Antibiotic treatments usually last around 6 weeks and are administered through an IV. Many cases of osteomyelitis require surgery. Surgery may be done for a variety of reasons, including draining the infection, removing infected bone, getting blood back into the bone, or, in the worst case, amputation. If you are experiencing bone pain, a fever, and swelling, it is imperative to see an orthopedic specialist. The physicians at the Illinois Bone and Joint Institute are some of the best orthopedic doctors in the Midwest. Their experience and training in treating all types of orthopedic conditions, including osteomyelitis, make them your best choice for orthopedic care.
Tratamiento. Antimicrobial therapy shall be instituted and held cast. The effects body and spirit for culture shall be independent when the blood culturing is possible. Incision and drainage shall be actually made when there is supranastomotic access. Antibiotics would prevent ethical and by Staphylococcus aureus include anti-staphylococcal, penicillin, clindamycin, first generation, cephalosporin, and vancomycin. Conclusion: depending on the early diagnostic and treatment, mortality is low and complication rates approximately 5%. Because of the various causes of the disease is recommended. The treatment is individual for each case. Antimicrobial therapy should be institutional in all cases. The effect on spirit for culture should be anticipated while the blood culture is possible.